Hello everyone, welcome to the first podcast of Apeksha Hospital, Dibrugarh. So not too much training or not too much travel, otherwise regular work they can resume very easily. Since you brought up the topic of the pain part of it, now this is something that I'm sure most people want to know, that is it a really painful process that is not bearable?
Whenever one couple want to go for IVF now, we always say to the patient that there is no physical pain in IVF in the current day scenario. Whatever number of injections also are being given for IVF, now the companies have designed those injections in such a way that even the needle prick is so fine that you will not feel much pain of the injections also. Then the procedure itself, the ovum pickup I told, is given under anesthesia. So there is no question of pain. Embryo transfer is a 100% painless procedure. There is no physical pain. Yes, there is only some mental and financial pain to the patient because they are undergoing some or other kind of stress while they are undergoing the procedure. Now, one very important aspect which the people are mostly confused nowadays is the how much is the financial burden in cases of IVF right now. When I started my career and I was undergoing training abroad in India, various centers, I could make out that the cost of every cycle of IVF was somewhere around 5 to 7 lakhs, say around 20 years back. Gradually, the cost of IVF is reducing because of few things. One very important aspect, the cost of disposables have been reduced. The cost of media which were used earlier was very high. Now the companies are giving at cheaper prices, the rates are reducing. The cost of disposables are reducing in terms of IVF. Then comes the number of injections. I told you, initially the couple used to have, say, injections for 20-25 days period, which has been curtailed now to 10-12 days time because of the advancement in technology. So that reduces the cost burden of the drugs also. At most of the centers now in India, it depends on the architectural layout and the type of clientele of the center. But on an average, you can make out that other than the medicines cost, which comes on an average to 40 to 50,000 rupees, between another 1 to 1.5 lakh rupees, usually a couple can complete the cycle.
1
then
to 1.5.
Comes,
that's quite a very high for many people.
And that comes practical for many couples. Then the cost of freezing is also reduced. In the current scenario, if we are preserving embryos for a year or so, on an average the freezing cost comes to somewhere around 25 to 30,000 rupees per year. There are a lot of confusions related to the use of frozen embryos. Suppose I have done an embryo transfer, a couple to pregnant. Now the lady is pregnant. Now she says, doctor, what I am going to do with my frozen embryos? মই এইটো কি কৰিম যদি এই ফ্ৰোজেন এমব্ৰিয়ছ কেটা তেওঁলোকে কন্টিনিউ কৰিব পাৰে ফ্ৰিজিংৰ কাৰণে that freezing even in the current scenario can be done up to 5 years. Then if the couple delivers that baby আৰু এই বেবি জন্ম হোৱাৰ পিছত 2 বছৰ পিছত 3 বছৰ পিছত তেওঁলোকে ভাবে যে মই আকৌ I want to try for the second pregnancy, the same embryos can be transferred.
So during this time, they would just have to pay for
the freezing cost, preservation cost, which usually now again has reduced to say a cost of 25 to 30,000 rupees per year.
That's quite a good news for many, because many have this misconception that this is a very costly procedure and they cannot afford it. I'm sure 25-30,000 they might be spending on many other things, and this could be something that has much more impact in their life. And even the IVF process of 1.15, I'm sure people are having a clarity on that, because there seems to be quite a misconception about the cost factor in this. And many people, because of this, don't come forward because they believe that that could be quite a big burden for them. Now, many times people also have this fear that while doing embryo transfer or the medicines that they take, are there any kind of side effects that they might have?
See, our explanation to most of our patients are that whatever you are breathing, that air also gives you some side effects. Whatever you are drinking in terms of pure water is also giving you some side effects. Whatever you are thinking that you are eating organic also has some side effects. The same way, because I told you, the uses of drugs have been minimized to a great extent. The safety points of the patient has been considered in a great way. The companies are modifying the hormones in such a way that they are more or less like a natural preparation. Yes, theoretical risk factors exist, but practically in my career of 20 plus years, hardly we have seen anything which is going disastrous for the patient because the lady has undergone IVF. Never like that.
Okay. But in terms of side effects, like what kind of side effects are you
talking?
See,
some patients, they have some fluid retention because of use of hormones.
All right. Okay.
Some patients, they have some body swelling. Some patients, they might develop some forms of edema. Some patients, they might develop some forms of irritability because of fluid retention. Those things are very transient. Say if you develop an episode of influenza and you get some weakness and you get some muscle lethargy, it's more or less like that. You cannot compare these side effects with any serious disease or any serious ailments. It's like a side effects after you develop a running nose.
Okay, that kind of. So when we talk about IVF cycles, how many cycles is actually required to?
See, when we were talking about the age factor, the late marriage, this was the main reason. Because if the ovaries are aged, your capacity to produce good number of eggs is less. Younger the patient, more the eggs, more the quality of the eggs, more the potential of developing a good embryo, more the chances of getting a success rate. But in the later age group, your oocytes become fragile, your oocytes become aged, your number of oocytes also gets reduced, direct embryo quality is affected, your number of embryos is also less, you get less to freeze, you get less to transfer, you get less success rate.
Okay. So is there any kind of cycle that you see that 4 to 5 cycles is required or 2 to 3? Any
Not
numbers
usually. If the cycles are planned in a scientific way, if the couple is ready to understand what we want from them, if they are ready to lose some weight, if they are ready to reduce some stress, if they are ready to bring some smiles on their face, then the clinician can very easily bring a smile to their face by giving them a kid. Because the quality of eggs is important, not the number. Number is important for continuation of the cycles. But even 1 or 2 good quality egg can give you a pregnancy even in the first embryo transfer.
Right, very true. Now, since you have spoken about quality of egg, now many people nowadays also want to know, can they genetically initially find out whether they have
not exactly genetically, because the genetic impact on embryo is not very common. But what affects your egg quality is the factors which we have already talked about. There is a very good biochemical test available nowadays called anti-Mullerian hormone, which judges the quality of your egg. Then there are very finer versions of transvaginal ultrasounds which can give you a 3D picture of your ovaries. You can calculate the number of eggs, you can calculate the size of your ovaries, you can predict the behavior of the endometrium. Those things are the direct scientific evidence which tells you how good is the quality of your egg.
Okay. One more thing which people want to know is when they have this kind of scenario, do they actually require a counselor to keep themselves calm, or is it?
In my practice, what I have understood till now, your clinician is your best counselor, because he understands you from the beginning. He understands you from the time you visited his clinic. He understands your smiles also, he understands your tears also. And if a counselor is there, true, the thing is how well the counseling has been made to you, whether you were given the positive aspects or you were given the negative aspects, or was those the balance aspects which you were being told. So I always believe that it should be one-to-one interaction between the clinician
and the patient.
Yes, and then your team matters. But if you think my counselor will only do counseling to my couple, then I don't believe this is going to work much.
Yes, because the clinician would be knowing the history of the patient
True.
in and out, so they would be the best judge.
Yeah.
Okay. If there is an issue that has come up after the embryo has been transferred, how can a patient know about it to basically come forward? Because
see, usually the complications which are there in any patient who is pregnant are the same.
Yes.
After embryo transfer, like we always say that every pregnancy carries a risk factor of abortion, of a miscarriage, of a early pregnancy demise, of a early pregnancy failure, somewhere between the range of 15 to 25%.
Okay.
The same failure rate exists for the pregnancies conceived by the process of embryo transfer as well. Some people have a misconception that IVF carries more failure rate in terms of miscarriage. Not true. Because if there is a healthy embryo and it's being inspected in your lab, if the embryologist is saying this embryo is growing good, then usually those embryos are mostly healthy.
Okay.
So you cannot say that IVF increases the chances of miscarriage rate. It's not true. Then in cases where there are repeated pregnancy failures, where there are repeated pregnancy loss, where there is repeated miscarriages, these embryos can be genetically screened by doing a PGT, pre-genetic testing can be done. In exceptional cases, this is allowed. And if those embryos, which are screened embryos, are transferred, then again your risk factor decreases like anything. But yes, we don't recommend this for all patients because it increases your cost burden. It needs again enhanced technology, and then your journey in IVF gets a bit complicated. But in high-risk patient where there is positive history of repeated miscarriages, eketa couple of kami option to diu that you can go for PGT. Yes.
But what exactly is PGT and how is it useful?
Here, what is done? It's a kind of embryo biopsy.
Okay.
When the embryo is formed, there are individual cells, and in a growing embryo, when the cells are demarcated well, the cellular uptake is taken and the cells are studied for genetic structure. If it's found genetically faulty, or if it is positive for some genetically disposable diseases, then usually those embryos are discarded.
Alright.
And then you can be more sure about the quality of your embryo and the healthy conception.
So there is an option if a parent choose, then there is an option to actually go for this.
True.
It's not like it's not allowed.
No. It's very much allowed, but there has to be a scientific basis.
Okay.
And Government of India has come up with great guidelines in terms of infertility. The ART guidelines are already in Government of India Gazette, and it's uniform for all the centers for the various states of India, and it's already in practice nowadays. Government of India is strictly applying those norms to all the centers. So a lot of transparency has come in terms of IVF nowadays.
Okay. So I think one more question, which is a little sensitive topic, but people would still like to know is, how far is it feasible to get another person's egg or sperm in case the...
Yes, it's legally bound.
Yes.
It's legally bound.
Okay.
That there has to be proper indications for egg donation. Yes, Government of India allows egg donation, but there are special clauses, there are special conditions, and those conditions have to be fulfilled. The same thing exists for both male gamete as well as female gamete, as well as embryo handling techniques.
All right. Okay. So it's under certain guidelines that it is allowed.
There are full legal procedure for that, and every center is bound to follow this nowadays.
All right. And how well do you recommend it to people who are not having success ratios, maybe with their own partners? Is it an advisable?
See, always there is a ABCDE in terms of infertility.
Yes.
IVF is always a good procedure,
Yes.
but IVF is not the procedure for infertility treatment.
Right.
You should always start from the basics.
Yes.
And judge the need of time when you should proceed for IVF. You should not be in too hurry to go for IVF. You should not be too late to go for IVF. The decision has to be timely. And if you are sticking to one clinic, if you are sticking to one center, they can guide you well. The problem with the infertility couples is, since they are under a lot of stress, they are under a lot of family and social burden, then if suppose some form of treatment fails at one center, they immediately move to a second center, then to a third center, then to a fourth center. That increases more stress, that increases more failures.
Correct.
You should devote some time, you should understand the procedure, and then only you can be sure that whether you are a futuristic candidate for immediate IVF, for no IVF, whether the couple is going to conceive by natural methods or small procedures, whether it's sometimes a small surgical correction in patient's fallopian tube, small surgical correction in patient's uterus can work wonders.
Okay, so sometimes a minor surgery might be required to correct the situation.
Yes, true.
Okay.
These fallopian tubes, if there are fallopian tubes which are blocked, they can be opened by a very nice process of laparohysteroscopy nowadays.
Okay.
If there are some tiny problems inside the uterus where there is adhesions inside the uterus, sometimes there are some extra foreign growths called endometrial polyps. Once they are taken out, they improve the receptivity of the uterus. Sometimes some ovarian cyst removal might help. So those things have to be considered always first.
All right.
But if you find you are too late, and then your chances of IVF will get reduced, your ovaries will become exhausted, tired, fatigued, then after the initial corrections are done, when the things are made suitable for IVF, you should immediately go for it.
Okay. So what kind of health checkup should one go ahead before starting IVF?
See, whenever you are going for the procedure of IVF, means you are going to enter the phase of motherhood.
Yes.
That means you have to undergo the pregnancy phase of 9 months, followed by say 6 months to 1 year, a great phase of taking care of the baby, doing some exercises, giving breastfeeding to the baby. You are ready for sleepless nights to enjoy the joy of motherhood. So your medical fitness, your heart should be fit.
Yes.
You should be mentally fit.
Correct.
Your anemia should not be there. Your hormonal profile should be good. There should not be such ailments in your uterus where it's difficult to complete 9 months of pregnancy. So those things matters.
So all these tests have to be completed before
the pre-conception counseling, it is very important. The pre-conception fitness is very important.
Yes.
That's what I always narrate to our patients, that give some time to yourself, give some time to the clinic to understand your body.
Right.
And to understand your fitness, so that how your body is going to behave when you are pregnant.
Yes. So if they have such kind of issues, they will be brought to basically a normalized phase, and then they would be
exactly.
going ahead. So since you have spoken about the time factor, what exactly is like a cutoff age, or is there a limit to any age?
See, if there are no chances of natural conception because of the medical reasons, because of the surgical problem, and your clinician has told you that the chances of natural fertility is very less, then at any age you should not delay it. You should immediately go for the intervention, so that you conceive, you complete your family, so that you are free to do anything. If, like many countries of the world are facing a burning problem, the very, very elderly couple, say at the age of 45, at the age of 50, 55, there is no age limit for embryo transfer and IVF. If that couple is getting a conception and getting pregnant, by that time the child is 20 years old, most of them are not there in the world. Then it becomes a social burden. So we always say that complete your family sooner, Once you find that the chances of natural conception are not there, or you have tried enough, you should not delay it. You should proceed for your ultimate treatment, which is by IVF.
Okay, that's great. That was quite an eye-opener and very insightful, because these are the very questions that everyone have in mind nowadays, but difficult to come forward, difficult to ask, and Google gives too much information, I guess, for everyone to understand what to pick and what not to pick. So we have Dr. Ashok Agarwal, who answered all our queries beautifully today, and I'm sure it has also helped people who are waiting for such answers to come forward and have the joy of their life in their arms. So thank you, Dr. Ashok.
Thank you. Thank you.